Do you know what a gynecologist is?
Actually, I do. My uncle is a gynecologist. He studies the female anatomy, especially in the groin area.
A gynecologist is a doctor specifically for women who works in the region of women that men don't have.
Yeah, you know what a gynecologist is? No.
A gynecologist is a doctor who specializes in the female reproductive system.
Do I have to say it? No.
A gynecologist is pretty much another name for a doctor that examines, take care of, diagnose, and fix any problems of the vagina, cervix, and even the entrance part of the uterus.
Do you know what a pap smear is?
That's what's in the metal things of a coochie.
I don't know.
Has to do with either birthing babies or, you know, getting rid of some stuff you don't want in there. And
They insert the thing inside of your vajayjay. They swab, they check for STDs, if you're pregnant, pelvic disease, and all. You check your ovaries and all this stuff. And it hurts really bad.
I've been doing a lot of different types of exams, and one type that I come across fairly frequently is to do a pelvic gynecological exam on women. Pap smear is basically just a lab test, and it's one of those tests that you can do while you're doing a pelvic exam.
You take a scraping of the tissue at the mouth of the cervix, and it is submitted to the pathologist, and they look at it under the microscope, and they look to see if there are any abnormal cells. By doing this, you catch abnormalities in a very early stage when they're easily treated, and long before they become cancer, or if they are cancer, they're at an early stage where they're easily cured.
And then that's what we use to do pap smears. And that's what the pap smear goes into. It goes into a thin prep.
Do you regularly see your gynecologist for your annual pap smear?
Yes, I do.
About once a year.
Gynecologist now? Only when forced.
Yes, I regularly see my OBGYN and for my pap smear.
You're supposed to go once a year, but when I had insurance, I went a lot. Yeah, you have to go a lot.
It's something you should do every year, but...
Have you ever been with your wife or girlfriend to a gynecologist appointment?
Yeah.
No? Why not?
Busy.
And you, sir?
Yes, I have.
For what reason?
And
Support?
And support.
When did you first go, and how was your first experience?
I was 18 years old, and I mean, my first experience was good. Found out I was pregnant.
I was 17.
I was 16.
I was 16.
I was 24. It wasn't until I got pregnant that I went to the gynecologist. I was 16. I was 12 years old. I think I was 12.
I've actually never been to a gynecologist.
Probably about 19.
I was 15.
I first started going to see my obstetrician when I was 18.
Well, I was about 21. That's when I first lost my virginity. And I felt like right before I was about to have the act of sex that I was going to need a little something extra.
I would say it was a positive experience because I had never been there before. You know, 24. You know, that was too old. It was cold. You know what I'm saying? It's cold in there, and then when you have to put your legs up, that's just it's horrible. My experience was negative because that was my first time going through all of that process, so it was new to me.
Nothing really weird besides the doctor trying to crack jokes while they're checking you. That's really weird.
It was scary, but once you get through that first initial
visit, after that it's easy. It's a little awkward when they're between your legs.
It was very cold too, because you're naked. It's very cold. And the thing that they insert, the metal one is freezing cold, but the plastic one is way much better. The metal one hurt.
I told the doctor I was very uncomfortable with it, and she was like, "Well, how are you uncomfortable with it? How did you get this baby?"
I mean, it was about what I expected. I mean, it's just like going to any other doctor. It wasn't like awkward or anything in particular.
Well, the doctor was nice, but you know, I at the time had never had sex, so putting myself in somebody's face wasn't comfortable. He came in and he talked with me, and the nurse was in there with him, and I was a little nervous and, you know, leery of that. And when he came in, she was in there with him, and they asked me to lay back. Thing that I really was like, you know, there's something. They had a picture up on the ceiling. I said, well, praise thee the Lord, I got a picture to look at. And then he started, and I was like, woo, 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 now, wait a minute. Some things are going on that I wasn't used to.
Yes, I was extremely scared because my mother never spoke to me about things like that. So I go in there and, well, you know, went from there, felt me up.
It's funny because people are so impersonal nowadays, and people are so ashamed that I've heard of patients, I've heard of females waiting until they're 30, 40, even 50 before they even go to the gynecologist for the first time.
First time, if you take a deep breath and you kind of walk them through it and you support them at the end of the exam, they say, you know, that really wasn't as bad as I thought it was going to be. And
do you prefer male or female doctor?
I prefer a male doctor. It's hard to really put into words, but I don't really feel comfortable with a female looking at everything. I don't know why, it just kind of bothers me. I guess it might be the frame of mind I have about like my relationship with women. It doesn't feel right, so I prefer a male doctor, I guess. So.
Male, you would think he was being all, you know, perverted, and you'll get a woman would be very uncomfortable unless it was a nurse, a female nurse or something in there with them. But I probably still wouldn't want a male doctor.
I was nervous at first since he was a male doctor, but it wasn't about that. It was about me being healthy at the end of the day, so I didn't mind.
I've gotten to assist with some female physicals at the doctor's office where I work, and he's actually a male physician. So it's interesting to see that perspective. He's very professional about it. It's not awkward for him, I'm sure it's awkward for the lady, but it was just interesting to see that how professional he is about it and how gentle and just considerate he is of the woman.
I actually prefer a male doctor because females look at you funny. And a man just goes in, he dives right on in, does what he's got to do, and gets out. So, what are you having for lunch today?
Definitely a female. Usually they don't try to hit on me.
Women tend to prefer to come to a female provider as opposed to a male provider, so I tend to get a lot of exams from my male counterparts.
Does your wife go to a male or female gynecologist?
Female.
And how would you feel if she went to a male?
You know, it really wouldn't bother me, but I do feel that females tend to take better care of females when it comes to that type of care.
I honestly don't know why male gynecologists get in the profession. I have no idea. I really don't, because I want to say, you know, I want to help people. It's a profession that I'm interested in, but deep down inside, you know, it's something more. You know, I don't care what guy it is. There is something more to it.
What about as far as STDs go? What are the home remedies that people try instead of going to the doctor?
Vinegar. We had a woman one time with a severely bad case of gonorrhea, whom someone had told her that flushing with vinegar would cure it.
I've heard of the dumbest home remedies on the planet. Applying this cream, mixing mayo with these leaves, letting it sit for 2 days, and rubbing it here to get rid of the wart, or the bump, or the bumps, or the discharge.
I had a lady that had taken that she was supposed to do a depository, and there was a very bad smell, and we couldn't figure out what the problem was. She had done it. It said use jelly, so she used grape jelly.
People are super dumb. So people like to do shortcuts. So the home remedy will be like, put this gel on you for 4 days. Sweet tea, honey, and spinning around 3 times with a stick up in the air singing Kumbaya is not going to cure everything.
I had a teenage girl tell me at one point in time that she was told if she douched with Coca-Cola that she would stop from being pregnant. She was basically dumbfounded and asked me more questions than I could answer.
You try to educate them. Try to educate them on the practices of safe sex, different types of vaccinations, the need to seek and, obtain a gynecologist.
I did have another girl ask me that if she had dry sex, could she still get an STD?
What is technically dry sex?
I'm yet to know.
Dry hopping.
It was not. I don't know what to do.
Something funny or embarrassing happens almost every day if you've got a good sense of humor.
I think more people need to talk about it. People need to understand it. You're walking around asking people, gynecology, what is it? And really, even though people joke around about it, they really don't know. So I think gynecology is the equivalent of sex ed in school. It should be around more, but it's not. So
you should go see a gynecologist if you're of the female persuasion.
It's important. It's something everybody needs to get done, and but just not me.